Many people think addiction and mental health disorders are separate problems. They're not. Hello, I am Dr. K. Paul Stoller, and for millions of people, addiction and mental illness are not sequential struggles. They are simultaneous. This is what we call the double struggle. It is really a triple struggle because the brain scans of addicts look almost identical to those with traumatic brain injury. In medicine, this is known as triple diagnosis, or co-occurring disorders. It means a person is dealing with all three: a substance or behavioral addiction, and a mental health condition such as depression, anxiety, PTSD or bipolar disorder, and an old traumatic brain injury. And here's the critical point: one does not simply coexist with the other, they interact, amplify, and entrench each other. For many people, addiction begins as an attempt to cope, self-medication, to quiet anxiety, to numb trauma, to escape depression, to sleep, to feel normal, if only briefly. Substances and compulsive behaviors can temporarily reduce psychological pain, but that relief comes at a cost. Over time, addiction alters the brain's chemistry. Dopamine systems weaken, stress systems intensify, impulse control declines. As addiction progresses, depression deepens, anxiety increases, trauma symptoms worsen, emotional regulation erodes. What began as self-medication becomes self-perpetuating damage. This is why treating addiction without addressing mental health often fails. Of course, no one addresses traumatic brain injuries unless they operate a hyperbaric oxygen clinic. You cannot heal one system while leaving the other two dysregulated. Recovery requires an integrated approach, one that understands the brain, the nervous system, trauma, behavior, and meaning. When addiction, traumatic brain injuries, and mental health are treated together, something changes. Relapse rates fall, emotional resilience increases, hope becomes grounded, not fragile. I now have a comprehensive webinar to end addictions at www.kennethstollermd.com. I have been able to treat a 15-year-old brain injury from alcohol poisoning using hyperbaric oxygen. In my webinar, I go over a comprehensive protocol that has the potential to end all addictions. But the brain also needs to heal from the insults. If this resonates, join me at kennethstollermd.com. Because healing begins when we stop treating symptoms in isolation and start treating the whole human being.